Thanks so much, Sean. And it is a big week for Indiana lawmakers at the State House.
That's where House and Senate members are unveiling their agendas for what they would like to get accomplished over this upcoming legislative session. And at the top of the list right now is drafting the budget. And when they're doing this, it's a 2-year budget cycle.
Yes, 13 News State House reporter Emily Longnecker joins us live from the State House tonight to tell us about the plans that Senate Democrats announced today. Emily, fill us in.
Well, ladies, yesterday we heard a lot from Senate Republicans about what they wanted to have in the budget and the property tax relief that they wanted to bring. Today we heard from Senate Democrats. They say they have plans for the budget too and some proposals for property tax relief, but they say they've also heard from their constituents about other worries they have in the areas of healthcare, housing, and education.
Budgets aren't just numbers on a page. They're a statement about priorities.
When it comes to public education, Senate Democrats said their priority is fully funding it. They filed a bill that would raise starting pay for Indiana teachers to $65,000 as a way to address the more than 2,000 open teacher positions across the state.
And that's not just a number. It is a crisis. It means larger class sizes, it means overworked teachers, and it means fewer opportunities for our kids to be successful.
Senate Democrats also want to expand the state's On My Way pre-K program and the Child Care Development Fund. Both programs help lower-income families pay for child care. Both programs are facing wait lists for new families who want to sign up.
Let's be clear, creating a wait list for a program that helps parents afford child care, like we've seen recently, is not acceptable. Families need support now, not years down the line.
When it comes to health care, Senate Democrats want Medicaid to start covering doula services for women giving birth. They also want to expand mental health care for moms after babies are born and establish a stillbirth prevention program to help address maternal and infant mortality rates. Indiana has some of the worst in the country.
This is a vital step to ensure no mother or baby is left behind.
During his campaign, Governor-elect Mike Braun said he wanted to address the problem by increasing access to obstetric care in rural areas. Other proposed measures around health care from Senate Democrats prohibit Hoosiers' wages from being garnished or liens put on homes because of unpaid medical bills. Calls by Senate Democrats for new services covered by Medicaid come even as Republican lawmakers have warned this budget year could be a tight one, pointing out Indiana brought in less revenue this year than in previous years. Wednesday, Senate Republicans proposed capping the state's Healthy Indiana plan to mitigate increasing Medicaid costs. The move could leave more than 200,000 Hoosier adults looking for medical insurance coverage somewhere else. Democrats warn that will just send more uninsured Hoosiers to the ER for basic health care.
They will have to seek their care through emergency services, and it will end up costing the state and taxpayers more.
So again, Senate Democrats, they are going to be unveiling some of their proposals to bring property tax relief to Hoosiers, but it is really their position that local school districts, local governments, they have to rely on property tax revenue too much to fund schools because they do not get enough money from the state to pay for education. Now, speaking of education, do you remember that bill we told you about yesterday, 1136, that would see the state taking over school districts with declining numbers? We heard from Senate Democrats today about that bill. We'll tell you what they said at 6. Here's a hint. They are not too happy about it. Anne Marie, Felicia?
All right, Emily Longnecker reporting live for us tonight. Her coverage continues here on 13 News at 6.